Hello everyone, Hello everyone, my name is Sanjivini Puyad. Technical topics, my subject is causally assessment. Causally assessment is an integral component of the medical review and could determine the possibilities of intake of drug and occurrence of the adverse event in individual patient is called as the causally assessment. Causality means behind the ADR and objectives of causal assessment. This is the uh, helps in signal detection and to establish the relationship between drug and event and evaluate the risk and benefit balance. An evaluation of ADRs reporting easily ordering system and for the regulatory authorities. Causal assessment is methods is global introspection, WHO in WHO UMC system and Naranjo's logarithms. Third, methods of causal assessments. Causal assessment is a process that determines if in a medicine or vaccine is the cause of an adverse event. It's a key part of pharmacovigilance and it is used to identify new safety signals assessment the risk benefit ratio of medicine or vaccine ensure that risk minimization are based on the evidence. Causality assessment is performed by the variety of professionals, including medical office and investigators and drug safety professionals. There are several methods and logarithms for causal assessment, including Naranjo logarithm, also known as the Naranjo scale. The scale was developed in 1991 to help standardize the assessment of adverse drug reactions. It assigns a probability to the likelihood that an ADR is and due to the using a scale of definite problem, possible or doubtful. Ha- Hill, Hill criteria established in 1965 by English epidemiologist Sir in Austrian Befraud High is group of the criteria assessed in causality from the multiple information sources. WHO UMAC method. This method classifies causality as a certain, probable, possible, unlikely, unclassified, and unclassifiable. Although these are several methods available in none is considered the gold standard and user varies from countries to countries. Causality or relatedness in assessment in adverse drug reaction and it is the relevance in a dermatology and causality assessment is essentially means the finding a causal association or relationship between drug and drug reaction, identifying the culprit drug and can be life saving or helpful in preventing the further damage caused by the drug to our body system in dermato practice. When it comes to cutaneous adverse drug reaction, this is much more than important and relevant because many etiologies can produce some similar cuteness and manifestation. There are the multiple criteria for logarithm available as of now for establishing a causal relationship. In case of adverse drug reaction, these ADRs, including that the none of them is specific or complete. Most the events causality assessment tools the use of Caradial principles of diagnosis of ADR such as temporary relationship of drug with the drug reaction, biological possibility of the drug causing a reaction, de-challenge and re-challenge. The present study reveals some of the established commonly used as catalysts and it is the implication or relevance to the dermatologist in clinical practice. In routine dermatology practice is relatedness assessment is done based on the desired clinical history and examination to look for the temporary correlation of a suspect drug to drug reaction, biological possibilities, effect of the challenge of suspect drug in reducing signs and symptoms of a drug addiction and effect of the rechallenge loading the recovering of drug reaction is administration in drug reaction system of drug reaction is effectively challenge leading reoccurrence of drug reaction. And last being attemptless case of severing cuteness adverse drug reaction. At times, this is assuming are the highly subjective and are based comparatively on the clinical endorsement and experience individual clinical. However, over many years this has been implemented in our practice. Introduction in causality assessment is essential mean the finding a causal association or relationship between a drug and drug reaction. It is the evaluation of the likelihood that particular treatment in this cause of an observed ADRs event. This importance challenging part of pharmacovigilance in with the attempt are made in to find the out of the exact drug responsible for causing drug reaction. This is important in clinical practice. More drugs are folding the market and are used by your patients and more likely to cause the side effects. Based the is effect in percentage of efficacy. Safety in these drugs is usually ignored as safety is of patient is more important than efficacy. Identification the culprit drugs becomes much more essentially the principles and methods of causality assessment. Causality assessments will help to the clinicians identify the culprit drugs, and there are multiple criteria for the logarithm available as now for establishing a causal relationship in case of adverse drug reaction, including then the specific of complete the present study reviews and some of the established company used CATs in implicate prevalence dermatologists of clinical practice need of the causality assessment in dermatologists. Causality assessment is important and every discipline medical practice identify the cultivate of drug system in our caused by the drug or body system. Thank you.